I chose case 8.6, which is Tylenol, the swing in product safety. Case background. So Johnson & Johnson is one of the largest and most respected healthcare companies in the world. Founded in 1886, it is known for its corporate credo, which states that the company's first responsibility is to patients and consumers before their shareholders. This credo has shaped the company's reputation as a brand people trust. Tylenol became one of its most important over the counter products and a common pain reliever in households across the country. Because so many families relied on Tylenol, the company's decisions surrounding the product carried not only a financial impact, but serious consequences for public trust and consumer safety. So the key players are first Johnson & Johnson, which is the parent company, and they set the overall culture and are known for their corporate credo. And in 1982, their response reflected those values, or somewhat reflected those values. And then next is McNeil Consumer Healthcare, the subsidiary responsible for manufacturing and distributing Tylenol, and many of the later quality control problems, which we'll see in the timeline next, including the phantom recall and contamination issues, occurred at this operational level. And this suggests that the breakdown may have been structural and not just a one-time mistake. And the FDA plays a regulatory role ensuring drugs are safe and properly manufactured. When complaints weren't reported quickly or recalls were delayed, it created tension between McNeil and regulators and also raised questions about transparency. And then consumers, which are the most vulnerable stakeholders, millions of families, especially parents of young children, trusted Tylenol as a safe over-the-counter medication. That trust carries serious moral responsibility. And then finally, shareholders expect financial stability and returns. Large recalls and public scandals directly impact company value, which creates pressure on leadership. This is where the ethical tension becomes clear, balancing profit with consumer safety. Tylenol had a lot going on in the case study, so I tried to compile it into a timeline. So in 1982, 8 people died after taking cyanide-laced Tylenol capsules in the Chicago area, and at the time, Tylenol was one of the leading over-the-counter pain relievers in the country. Although the tampering happened outside the company, Johnson & Johnson made the decision to recall millions of bottles nationwide. This moment became known as the gold standard in crisis management. Shortly after, in the same year and the year after in 1983, the company introduced caplets and tamper-proof packaging. They redesigned their packaging with multiple safety seals to prevent future tampering. This permanently changed packaging standards across the pharmaceutical industry and helped rebuild public trust. Then, about a decade later, 1994, a major study revealed that moderate overdoses of acetaminophen, Tylenol, especially when combined with alcohol, significantly increased the risk of liver injury and even fatalities. This shifted the concern from tampering to just the risks of Tylenol itself. In 2008, a different type of controversy emerged. McNeil, the subsidiary responsible for Tylenol, conducted what became known as a phantom recall of their product Motrin. So instead of issuing a public recall, the company hired contractors to quietly buy back products from store shelves without informing consumers that there was a problem. This raised serious questions about transparency and trust. And in 2010, McNeil recalled children's Tylenol, Motrin, Benadryl, and other products due to contamination and manufacturing issues, including reports of metal particles in the capsules, or the caplets now. Around the same time, additional testing revealed that some products were contaminated with mold, traced back to chemicals used in shipping materials. These repeated quality control failures suggested deeper structural problems within the company. Finally, in 2012, infant Tylenol returned to the market, but was then recalled again due to packaging defects. So the critical issues at stake are first, the tension between consumer safety and corporate reputation. When safety concerns arise, does the company act immediately to protect consumers, even if it risks financial loss or brand damage? Or does the company manage the situation to carefully minimize impact? In the case, it mentioned how the mold recall took a year, but actually could have taken 3 days. So, were they focusing on consumer safety at that point or brand reputation? Second, there's an issue of transparency versus risk management. The phantom recall raises questions about how much information consumers deserve. Is it acceptable to quietly remove products to avoid panic, or does ethical leadership require full public disclosure? And third, we see the tension between legal compliance and moral responsibility. Meeting FDA standards is required by law, but is it enough? Or should companies go beyond the minimum when there is potential risk to human life, like we see in this case of fatalities and organ damage? And finally, there is an issue of corporate culture and structural accountability. Were these isolated mistakes, or do they point to a deeper problem in quality control systems, reporting processes, and leadership priorities? The critical issues in this case go beyond individual recalls. They are centered on whether Johnson & Johnson consistently prioritized consumer safety over profit, whether transparency was sacrificed for reputation management, and whether structural weaknesses led to these issues reoccurring. The moral, ethical, structural, and religious issues. So the moral issues were prioritizing brand reputation over fully addressing injuries and fatalities, and then questioning whether human life consistently came first. The ethical issues are continuing to sell a product known to cause serious harm when misused, relying heavily on warning labels, and using marketing claims like nothing safer despite real risks. And then structural issues are repeated quality control failures, delayed reporting, a weak oversight system that suggested safety was not consistently prioritized. And then finally, there are religious issues, which is whether profit and reputation guided decisions or whether stewardship and the value of human life were truly the highest priorities. Comparing a worldly versus Christian perspective. So, from a worldly perspective, the company appeared to focus more on protecting its brand reputation than fully prioritizing consumer safety. While recalls were issued and did help consumers, they also protected the company from long-term financial and legal damage. In situations like the phantom recall, products were quietly removed, which suggests an effort to protect the company's image. The response often seemed centered on staying within legal boundaries rather than taking extra measures to go beyond what was required to protect consumers. And then from a Christian perspective, the approach would look different. So we are called to honor others above ourselves and above financial gain. That means being transparent and honest even when it hurts the brand. It means acting as stewards of people's health and trust. Instead of focusing only on meeting guidelines, a Christian approach would prioritize safety first to protect consumers, not just abide by the rules, but go above and beyond to truly care for people who rely on the product. The 4 coordinates, starting with religious orientation: who owns your heart? In this case, it seems like McNeil and Johnson & Johnson began prioritizing profit and reputation over their consumers. The lack of urgency in some recalls and the lack of transparency suggested that they were more concerned about how the issue would affect their brand than how it would affect people. And the creational structure: what is God's good design? So God's design for medicine is good. It's meant to help people and protect life. It's supposed to serve others, and profit isn't wrong, but it shouldn't be the main goal. The purpose of medicine should be safety and care first. When financial success starts to matter more than protecting people, the company moves away from that design. And then creational development. These issues didn't happen just once. They were repeated recalls, contamination problems, delayed reporting, and the phantom recall. And that pattern suggests a culture problem, not just a single mistake. And over time, there seemed to be a lack of transparency and integrity in how issues were handled, and then small decisions compounded into larger trust failures. And lastly, contemporary response. How can we join in Christian centered renewal? Moving forward, the response has to include greater standards, greater transparency, and greater accountability. Companies should not try to manage how close they can get to the line. They should build strong safety margins. Consumers' protection should clearly come before reputation management. If trust has been broken, it has to be rebuilt through action and not just messaging. And now to discuss your wonderings. So first, are warning labels enough? I don't believe warning labels are enough. Often they don't fully communicate the seriousness of potential risks. If a product can cause organ damage or death, the responsibility shouldn't fall primarily on the consumer to use it correctly. The company carries the greater responsibility. If the risk is severe and foreseeable, that should prompt stronger action than simply adding more text to a label. Second, how much harm is acceptable before recall? As Christians, I don't believe there should be a minimum percentage of harm required before action is taken. Most medications have side effects, but they should be kept minimal. And when side effects including liver failure or death, that goes far beyond the normal risk. And at that point, protecting people should far outweigh protecting profits or financials. Third, was the recall about morality or reputation? The case mentions that without tamper-proof packaging, the company risked the survival of Tylenol and Johnson & Johnson. That statement suggests brand survival was a major concern and maybe even above consumer safety. While the recall did protect consumers, it's hard to tell whether it was tied to guarding the company image or actually protecting customers. As Christians, our focus should be the well-being of people first and not brand survival. And number 4, is marketing language like nothing safer acceptable? So claims like nothing safer create a strong perception of safety, but no pharmaceutical is completely risk-free. When serious side effects are possible, marketing should reflect that clearly, and ethical advertising should communicate risk honestly and not overstate safety. So number 5, how does a company rebuild trust? Trust is rebuilt through transparency and consistent action. Tylenol regained trust in 1982 through bold action and visible accountability. However, repeated recalls and quality issues make rebuilding harder. To gain trust long term, the company must focus on safety improvements, honesty, and stronger standards overall. And then lastly, if there's any recent recalls. Tylenol has had a recent recall. In 2025, the FDA issued a Class 2 recall on around 3,000 bottles of Tylenol due to a defective container. And also, there has been some buzz around suggesting that Tylenol during pregnancy may be associated with neurological conditions, including autism and ADHD, which is kind of interesting. Case resolution. First, the standards need to be higher. It shouldn't just be about meeting legal requirements. Especially in healthcare, companies shouldn't work as close to the line as they can. Instead, they should focus on safety and making sure their systems protect consumers well before there is serious harm or fatalities. Second, safety systems need to be proactive and not reactive. Problems shouldn't be only addressed after people get hurt. Strong quality control, clear reporting processes, and early actions should be the norm. When recalls do happen, there needs to be full transparency and accountability, not quiet removals or delayed communication or trying to hide something. Consumers deserve clear and honest information so they can make informed decisions. Ultimately, companies should seek the interest of others before their own. That means putting trust and consumer well-being ahead of their reputation or financial pressures. Real resolution isn't just fixing a defective product, it's creating a culture where doing the right thing becomes standard practice, not just something that's done in a crisis. So, in conclusion, the Tylenol case shows how quickly trust can be built and how easily it can be damaged. While Johnson & Johnson once set the standard for crisis response, later decisions raised serious concerns about transparency, safety, and their priorities. This case challenges us to think about what truly guides business decisions. As Christians, we are called to value people over profit, protect life over reputation, and lead with integrity, even when it costs us something. In the end, ethical leadership is not just about responding to crisis well, it's about building systems that prevent them in the first place.